Welcome back. In the United States, the president there, Joe Biden, has formally declared that the COVID-19 pandemic is over in that country. In the US, over 1 million people died from the disease. It's the country with the highest number of official deaths from COVID-19. Meanwhile, here, we're still seeing some cases on a weekly basis, but as I understand it, very few deaths. Professor Tim Tucker is an adjunct associate professor at the UCT School of Public Health. Professor Tucker, good afternoon to you. Is the US President Joe Biden correct medically when he says the pandemic is over? Is there a definition of when a pandemic is formally over?
No, and that's what makes it complicated. He's gone into a space which may well be justified, and time will tell, but there still is an epidemic going on in the US. I think there are 400 deaths a day still, if I remember correctly, and it is a spread of substance. So it is more of a political framework that he is giving us. It's certainly not the World Health Organization framework or their own Centers for Disease Control answer. But I think it does signal an incremental view around the world from the World Health Organization head, from the US president, that we're now having to learn to live with this virus and that it's never going away. And as such, there comes a time when the levels have dropped to an extent where we can say that the pandemic is over, but it doesn't mean that we don't have to worry about it. We still have to take all of the appropriate measures.
It's interesting you say it's never going away, because, I mean, if you look around South African society on your average Saturday afternoon mass event, I mean, you'd think it was never here.
Yeah, and this is what we do as society. We learn to live with these pandemics that become endemic. We've had influenza since the early 1900s. We have tuberculosis, where there are thousands of deaths every year. There are many diseases that we learn to live with, and as such, we have these risk ratios when we socialize, when we work, when we travel, and as the numbers of infections drop below a certain point for each person, because each person's risk profile is different, we behave differently. But it isn't going away. It is here forever, as the other coronaviruses that have been in humanity for a very, very long time remain with us, as influenza A and B, the rhinoviruses, the adenoviruses. I can go on as a virologist about all of the viruses that we learn to live with, the respiratory ones I've mentioned now. And this is what we're seeing, a society learning to live with COVID.
We saw the damage wrought by this pandemic, so the sheer number of people who died, the number of people in our society, the number of people around the world. Do you think that, I mean, what do we need to do to make sure we're better prepared for when the next pandemic comes along? Because if there's one lesson that we all need to remember from this, is that another pandemic will come along, something new.
It will come. It's just when and which biological agent it will be. So it may be next week, it may be next month, it may be in 20 years, but the whole world needs to be more robust and ready for the next pandemic, which requires us to invest long term. It's not in an election cycle that we're talking about. We have to, as society, realize that we have to build a more robust, comprehensive health system, which entails so many different factors. So we need to have a National Public Health Institute, which is an extension of our National Institute for Communicable Diseases. We have to have surveillance ongoing, both in humans and in animals, because almost always the spread, as we've seen with SARS-CoV-2, with HIV and others, is a spread from animals to humans. We need to build our laboratory capacity, because as we saw in the early phases of the epidemic, despite having a robust and excellent public health sector and private health sector, in the laboratory sector, we were not able to access the chemicals, the reagents as we call them in the trade, to be able to do the tests. We saw an overrun of the clinical fabric in health. And so we need to work out how we can have these expandable modules of clinics and hospitals for those who require healthcare. There are a myriad of elements, and those are just the biomedical ones. So we still need to ensure that we have policy preparation. We need to ensure that we learn from this pandemic with regard to the socioeconomic destruction and how we care for those most vulnerable. And maybe something I can just bring up at this stage. What we saw across the world was that those who are most poor and most marginalized were most affected. most affected when it came to infection levels, most affected with regard to serious disease and death, and we need a more equitable response.
I mean, there's a key issue there, particularly it's a socio-political issue as well. One of the key issues for all of this, Professor, I suppose, is that countries need to be better used to and better at working together. Key to that is transparency. I know stepping into China's record and all of this can be quite complicated. Is there a lesson about transparency and disease here?
Yes, and I think transparency is linked to scientific integrity. And I think that what we saw, particularly in the early phases of our pandemic, some would argue that it waned a bit over time, was a rigorous attachment to science and transparency. And you mentioned China. And, I think that we see different global cultures relating to transparency, and China may not be the benchmark for where we're aiming. But I think that as we prepare for a future pandemic, which will happen, we need to ensure that our leadership is science-driven, data-driven in an age where it seems that much of the world is not too attached to the truth. And we need to have transparency in that. And part of the reason for transparency also is that we've just learned so much during this pandemic. At the beginning, we didn't know much about the virus, who was at risk, how to prevent infections, the relative contribution of washing hands versus masking up, and so on. And so transparency also is a strength for government, because it is inevitable that, particularly in the early phases, they'll get some things wrong. And if one is wrong and transparent, you're far more likely to get a better community response than if you're wrong and hidden in your processes.
Professor Tim Tucker, thank you very much indeed. Really appreciate it. Adjunct Associate Professor at the UCT School of Public Health.